Good afternoon. I'm Tonya Winders, the President and CEO of Allergy and Asthma Network, the host of your webinars program today. Today's program is titled Vaccines, Social Guidance, and Asthma, a Global Glance at COVID-19. We will look at COVID-19 from both a national and an international perspective. We welcome you to the 16th webinar in our series of special COVID webinars to address the unique issues related to the coronavirus. Over 40,000 people have now viewed these COVID webinars, and we are so glad that each of you have joined us today as one of the over 1,300 registered for this particular topic. I would also like to introduce our speaker to you today. We're joined once again by Dr. Purvi Parikh. Dr. Parikh is an allergist and immunologist at Allergy and Asthma Associates of Murray Hill. She is currently on faculty as clinical assistant professor in both departments of medicine and pediatrics at NYU School of Medicine. She is passionate about health policy and serves on the board of directors of the Advocacy Council of the American College of Allergy, Asthma, and Immunology. She travels to Washington, D.C. to influence policy, advocate for her patients, especially on behalf of the organizations that she serves, like United Nations Foundation, Shots at Life, and Allergy and Asthma Network. Dr. Parikh is the spokesperson for Allergy and Asthma Network, and she frequently makes appearances as a medical contributor on our behalf to CNBC, Fox, CNN, and CBS. As a resident of New York, Dr. Parikh has been on the front lines of the COVID-19 outbreak, and she has unique perspectives around the virus. She is also currently involved as an investigator in multiple clinical trials for the development of the COVID-19 vaccine. Join me in welcoming Dr. Parikh. So during the course of our time together today, we will start out by taking a look at the current state of COVID-19, the numbers and how things are trending. Then I'll turn it over to Dr. Parikh, where she will update us on the vaccines. And then I will provide the global glance at COVID-19, given my role as the current president of the Global Allergy and Airways Patient Platform, a global umbrella patient advocacy organization representing over 60 patient advocacy groups from across the world. We'll round out our time looking at the different social guidance in the US and abroad. So as we get started, we'll launch our first poll for the day, and we'd like to know exactly who's joining us today. So which of these categories best describes you? Go ahead and enter your response if you're a physician, or nurse practitioner or PA, nurse or school nurse, respiratory therapist, asthma health educator, or a patient. We understand that you may actually represent more than one of these, but you can choose the one that most interested you in your perspective today. We'll leave the poll open for just a few moments. Looks like we've got just about 2/3 that have cast their vote, so we'll leave it open just another second and then close it out and share the results. All right, so it looks like we've got about 2% physicians, 2% nurse practitioners or PAs, 83% nurses or school nurses, respiratory therapists, asthma educators at 9%, and 4% patients. So this is very consistent with what we've seen from some of our other webinars as well. And again, we're so excited to see so many of you here, especially those that are healthcare providers and delivering care every day. We certainly appreciate all that you're doing for patients living with chronic respiratory conditions. So now let's take a look at the current state of COVID. And we love to go to this dashboard that is presented by Johns Hopkins, the Center for Coronavirus and the Center for Systems Science and Engineering at Johns Hopkins University. As you can see here, we have unfortunately exceeded that 50 million global case mark, where with 10%, with over 20%, over 10 million of those cases coming from the US. We also have exceeded the 1.2 million death toll due to COVID, with, again, over 240,000 of those coming from the United States. We'll get into more of the other countries and the trends around case rates and mortality when we take a look at the global perspective. But the Johns Hopkins COVID-19 dashboard really is the go-to source for looking at the global trends of COVID and how it is impacting not only the US and drilling down at your local level, but also the globe. Again, we always also double check all of our numbers with the CDC's latest data report. And you can see here, while it is a little lagging behind the Johns Hopkins data, it does demonstrate that we have over 10 million total cases in the US. And that the case rate over the last 7 days has certainly increased. And most of you probably saw the headlines overnight that yesterday we set a record with over 140,000 new case reports. The CDC also currently reports just shy of 240,000 total deaths here in the US, but we know, according to the Johns Hopkins data, that that number has now been exceeded. The interesting thing about the CDC data is that it does show where there are state pockets of additional activity where those case rates are higher. So the darker the color, the higher the case rate per population. So again, interesting to look at this over the course of the last 7 or 8 months and see how that clustering is happening a bit differently across different regions and states within the United States. Now, what about the headlines? What are we hearing from the headlines? Definitely, as the US adds new corona cases every second, hospitals from Texas to Wisconsin are really sharing this feeling of being overwhelmed. There's great concern about the soaring number of Americans that are critically ill, and it's not necessarily about the lack of hospital beds or the therapies or the equipment that most hospital administrators are expressing concern about. It really is that with more now than 240,000 deaths due to COVID, it's the mental and physical exhaustion of those hospital staffs and the emotional toll that it's been taking on the staff to care for those in need in this really challenging time. So I think we all would, agree that it's hard to be in this crisis situation for such an extended period of time, and especially for those no more than those on the front lines. So also in the headlines, the US has entered what we would call a second round of kind of back to school and return to school policies. Many are also looking at how they will do that as we're returning from the holiday season and what school will look like in January. But in smaller school districts, there's been careful in-person reopenings throughout August and September that really did not show an increase or rise in COVID-19 cases, notably. And so now it's some of the country's larger school systems that are looking at how they return to the classroom. There's also a lot of concern about college students. Many college students, I know my own 3, are on an abbreviated schedule this year and doing primarily virtual learning. But will they come home at the holidays? Will they bring the virus with them? There is a lot of concern about what this second semester of college will look like for the millions of young people that are on those campuses. And we have seen clustering of those at those campuses of cases. And then the CDC has also issued new guidance around redefining close contact and what that means when a person is within 6 feet of an infectious person over the course of 24 hours, how they should respond. And then there also has been additional guidance from CDC about mask wearing. And for many of the months of this pandemic, we have thought that mask wearing was really to protect others when wearing a mask in case you happen to be infected. But now we know that the mask actually may be protecting you as well from contracting COVID. So we are seeing additional understanding and guidance come out from the Center for Disease Control on these topics. When we look to our public health leaders and officials, definitely Dr. Fauci has been at the front of this as the nation's leading immunologist at the NIH, and he has, said that certainly it's understandable that we all have warm feelings about the holidays. We want to be with our family and friends, but we have to be realistic, and we have to step back and realize that if we have vulnerable people in our families, either those that are elderly or have underlying health conditions, that we really should think about either amending the plans that we have for Thanksgiving or stalling or foregoing those gatherings. And he, certainly I think that he empathizes. It's an unfortunate, unusual situation, but you probably would want to reconsider the risk associated with that of gathering with your family and this particular peak time of late November and December. And, we laugh here because some of there is, I guess, a brighter side if you're a turkey, because the turkey farmers are more anxious and the grocers are more anxious about predicting what will this look like for holiday tables. But definitely, I'm sure that the turkeys, if they could speak, would be glad that perhaps there's fewer turkeys to be consumed over the Thanksgiving holidays. But again, we know that this is a great concern to people, and that definitely as the numbers rise, we're all trying to figure out what is the best thing for our family gatherings and, trying to err on the side of caution. So what do the COVID-19 case rates look like day by day? We always review this trend because it's very interesting and definitely shows us over the course of these last 8 to 9 months how the case rates have grown. And so you can see that we did have that original surge in March, and then in July, and now again with us exceeding the 140,000 case rate per day yesterday. I think that we could safely say that this is the biggest wave of COVID-19 cases on a case-by-case daily report. So now we'll go to another poll question. What has the trend of COVID-19 actually been in your particular area? So I'll launch the poll. Have the numbers been going up? Have they been going down? Have they stayed about the same? Or are you really not sure? You may not be watching the numbers very closely at your local level, but go ahead and log your response and we'll see how things are trending. We did have registrants from all across the country. So let's see how the responses come in today. Give it just another moment here. I know for me, I have been quarantining in Tennessee most of the time, but happen to be in Virginia. Both areas are seeing significant rises and increases in case counts. Dr. Parikh, who I'm going to turn it over to here in just a moment, she is in New York, and she'll be able to share with us their experience. All right, I'm going to close the poll and share the results. It looks like that pretty universally, 93% of the case numbers are going up. No one reports that the case numbers are going down, and about 4% they're staying the same, and then a couple of percent that aren't totally sure. So, I think that this is, as I was saying before, the stark realization that the numbers unfortunately are continuing to rise. So now I'm going to turn it over to Dr. Parikh, and she is going to provide us with an update around the vaccines. Dr. Parikh?
Thank you very much. And yes, just to echo what Tonya had said, they definitely are going up everywhere, even in New York. Unfortunately, the percentage of the spread of infection doubled in the last 2 weeks. So now Governor Cuomo has issued orders that as of tomorrow, restaurants, bars, gyms have to close down at 10 p.m. And again, he's saying that you can't have more than 10 people in your home or in any enclosed space, private enclosed space. So we do have to be vigilant, because not only do all viruses increase in the winter because we're all spending more time indoors, so that includes flu as well. But with that, we'll start our update with some hopefully some good news around the bend. So, the coronavirus vaccine tracker, it's been a very exciting and innovative time for science because, you know, we've been forced to kind of meet the challenges of such a deadly global pandemic in a very short amount of time. You know, they said that the fastest vaccine developed before this one was the mumps vaccine, which took almost 4 years. So just so you get an idea, we're trying to develop something now in months, which normally takes years. But that being said, you know, we have now, you know, multiple trials around the world that are in those final stages before approval. And all of you may have heard, but this past Monday, Pfizer announced that they are getting ready to apply as well because they had very good results, almost 90% efficacy. Next slide. So the Pfizer and BioNTech data is that they're showing over 90% efficacy. And basically they found that, you know, the first 94 cases of COVID, you know, we're assuming from what they're saying, we're mostly in that placebo group, so the group that didn't get the vaccine. And they're expected to submit the application for emergency use authorization probably in the next week or two. And if their vaccine is authorized, Pfizer expects to manufacture over 1.3 billion doses of their vaccine worldwide by the end of 2021. The only kind of catch or downfall to this is that the vaccine does have to be in very, very cold temperatures for storage, so minus 80 degrees Celsius. So that's much colder than any normal freezer. So that's gonna might create some logistical hurdles, especially you know, may not be as easy to get a vaccine like we do normally in our doctor's office or pharmacy. There might only be certain limited locations. Also, another thing to note is that this vaccine is 2 doses. So you have to do 2 doses 1 month apart. So that's also a little bit different too. So, you know, to be fully vaccinated, there is that extra step that is not always with, let's say, the flu vaccine or other vaccines. But at least it's a glimmer of hope, you know, that there is some good data coming out, and hopefully they'll get that emergency authorization. So this preliminary data actually hasn't been peer reviewed yet, you know, so the general scientific community hasn't seen it. So I'm looking forward to seeing it. But at least based on their earlier data with phase 1, 2, the vaccine did look very efficacious, even though it was in a smaller group. So it looked like that it gave better immunity than even those who got sick naturally with COVID-19. So that's good news. But again, one, we don't know how long the immunity will last. There's a lot of logistical issues to getting the whole world vaccinated. So we still have to stay vigilant, especially as these cases are going up in the winter. So Moderna is also among several firms, you know, that have joined the president's initiative of Operation Warp Speed to put, you know, pharmaceutical companies in motion with federal financial support to rapidly produce vaccine candidates. I don't know if any of you saw 60 Minutes last Sunday. I happened to catch it because it was on after football, but they actually talked about how the military is planning on deploying these vaccines, and it was very interesting. So I encourage you all to watch all of that if you have a moment. And, you know, the results from a vaccine and drug trial phase from Moderna, you know, is also supported by the NIH. Now, again, this doesn't necessarily mean that Moderna is better than any other vaccine. It's just that they applied for NIH funding, whereas Pfizer did not. They decided to self-fund themselves. But we are expecting to see data from them soon, too. And the important thing to note is that both Moderna and Pfizer are similar technology in the type of vaccine they are. They both require 2 doses. They're both mRNA vaccines, meaning they kind of deliver instructions to your cells to think that they've been infected without actually infecting you with the virus itself. So it's very exciting, you know, if we have multiple approved and multiple options for patients. Luckily, this one doesn't have to be kept cold for as long. I believe it can be at room temperature for 10 days or something, or close to that. So then AstraZeneca and Johnson & Johnson are the 2 other vaccine candidates that are being tested in the US. So currently we have 4 that are in the final phase 3 stages before FDA approval. And the interesting thing is both AstraZeneca and Johnson & Johnson both have similar technology as well. So the first 2 we mentioned are those mRNA vaccines that deliver instructions to your cells to think that they've been infected without actually having to go through the infection. Whereas these two actually use what we call a vector. So they're almost like a transport vehicle that brings in the information into the cells as well. So it's similar, but it's a different way of introduction. And often what the vector is an adenovirus. So the common cold virus has been inactivated, so you don't get sick when you get these vaccines. But this adenovirus is kind of like a envelope, if you will, or a vehicle, that brings the information to your immune system. So these two have had a little bit more, delays and pauses. So the AstraZeneca vaccine was on hold for almost 6 weeks in the US due to an adverse event in the UK, and the FDA did their own investigation, and then it's been cleared for resumption, I think, in the last week or two. So, I was very happy to see the FDA did their own thorough investigation in addition to what other global agencies had done. And then Johnson & Johnson also had a brief pause as well. And I believe that they are still also on hold while the FDA does their due diligence. So again, this isn't to alarm anyone, but these are normal parts of clinical trials. And if the pauses and delays aren't occurring, I'd be more worried that, those safety checks are not being followed. Of note, there was also some news that there was a death actually in Brazil of a candidate in the AstraZeneca trial. So at first, when I saw the headline, I was like, oh no. But then when I looked more into it, it was actually a young doctor who was 28 years old who received the placebo. So the vaccine, ironically, may have saved his life if he had been in the group that got the vaccine. Because remember, in every clinical trial, we have half getting placebo, which is not a vaccine, and half getting the actual vaccine. So again, I'm just bringing the story up because we can't panic anytime we hear that there's a setback or a pause. And often it may not even be related to what's being studied. So this is the first time in history, at least that we have seen, probably since the Spanish flu, where the entire world is, trying to get ready to logistically roll out a grand scale vaccination. The Gates Foundation, who've always been champions of vaccination all over the world, they supply vaccines to many countries who can't afford them, have come out with their own 3-part plan, to eliminate COVID-19. So basically, they want to make it so, it's not just high-income countries or rich countries that have access to this vaccine, but that also the rest of the world does as well. So from a humanitarian perspective, I think obviously it's the right thing to do, an ethical perspective, but also it's still a risk, right? Because an outbreak in a poor country can still affect us here in the US because of globalization, because of travel. So it actually is in the best interest of everybody to make sure not just the high income or wealthy countries are vaccinated. Most of the world's supply is going to go to those rich countries first, just because of money issues. They have the capacity to buy millions and billions of doses. And then these other areas of the world that don't have the purchasing power to make big deals with pharmaceutical companies, these countries either will only be able to cover 10 or 14% of the population. So that's why these third-party agencies like the Gates Foundation, UN Foundation, their work is so important in getting everybody vaccinated. Next slide. So basically, their plan is to roll out vaccines to countries based on their population size. So the 50, richest countries will get the first 2 billion doses of the vaccine. And, if you could just take an idea and look at, the deaths averted by vaccination, it's huge, The issue too, though, is by only giving it to the richest countries, we might miss some of the most densely populated countries that actually do need it equally as much, because spread of a virus in certain areas like India, that, for example, that have billions of people who can't socially distance. We sometimes forget what a privilege it is to even be able to socially distance. Those countries definitely should be able to have access as well in helping reduce the spread globally. And the only way to eliminate the threat of this disease somewhere is to eliminate it everywhere. So again, I think it's more than just a humanitarian and ethical issue. It actually helps everybody for us to have these initiatives to get the whole world vaccinated. Outbreaks spread very easily, as we see with this one. You know, at New Year's Eve, we heard of the first cases in China last year, and then, you know, by end of February, March, we already had it on our shores. And so on that note, we do need to increase the manufacturing capabilities and, of course, the delivery. And this will be a large challenge given some of the logistical issues. So just a quick review, the Novavax is delayed. That's the Johnson & Johnson one, as I mentioned. They're still investigating what's been going on. Operation Warp Speed, the two furthest along are Moderna and Pfizer, and both of their vaccines are based on that messenger RNA technology, as I had mentioned. So again, none of these vaccines are going to make you sick. Nobody is injecting anybody with COVID-19, either active or inactive. I know there's a lot of misinformation and fear out there around that. So that you have my word on. And then same token with the AstraZeneca and Oxford, Johnson & Johnson, you know, those I think will be having positive results soon after. You know, those two had those pauses and delays. So, you know, it shouldn't be long before the companies know if the vaccines are working. Of course, we can't tell the future, but we're hoping that something will be approved before the end of the year. And then hopefully we can get most of the world vaccinated by mid-2021. And of course, priority will go to certain high-risk groups, healthcare workers, those with health disparities, and those comorbidities that put you at higher risk of severe disease. The flu vaccine, now this we've been saying since August, you know, get your flu vaccine. The last thing we need is a twindemic where our hospitals already are overwhelmed, you know, with both influenza and COVID-19. We're already short on beds for COVID alone. And every year, influenza does cause deaths in pediatrics as well as adults. Influenza does fill up hospitals. And frequently hospitals can't take on anymore just from that alone. So imagine flu outbreaks plus the COVID-19 pandemic can be disastrous. So the annual influenza vaccine is recommended for everybody 6 and up, especially if you don't have any contraindications. And, you know, you should get, there's different types recommended for different age groups. The inactivated influenza vaccines, recombinant influenza vaccines, and live attenuated influenza vaccines are all available. And for over 65, there's also the high potency, which we are recommending as well. And most of these vaccines will be quadrivalent, with the exception of one, with the MF59 adjuvanted vaccine, which is available in both quadrivalent and trivalent formulations. So it's best to, you know, speak with your physician, get the best vaccine that's appropriate for you. And we know that this vaccine works, you know, so when Pfizer announced the 90% efficacy of their COVID-19 vaccine, many of us were shocked because we would have been happy with a 50 or 60% effective vaccine. And the reason is, even with, it sounds like a low percentage, but even with 50 or 60%, you can save lives, you can stop hospitalizations. And if you do get sick, you're much less likely for it to become severe. So the composition of the 2021 influenza vaccine includes influenza A, the H1N1, as well as the H3N2, as well as influenza B. So scientists try to predict all the most common strains and most virulent, so that way people can be most protected. These updated components will be included in both trivalent and quadrivalent vaccines, and the quadrivalent will have an additional influenza B, so that's why it's 3, you know, tri versus quad. It has 4 strains, if you will, which is unchanged from that was included in the 2019-2020 season. The Fluzone high dose quadrivalent is approved in people that are 65 and higher. This is the high potency vaccine that I mentioned. And then also another one is called the Fluad quadrivalent. And again, these are just different names because different companies make them. So both of them are expected to have similar strains and similar efficacy. And you know, common question I get with COVID-19 cases surging, should people be getting flu shots? So yes, absolutely. We do obviously say limit going out, limit, interactions, but this is actually something that is necessary and essential. So definitely put on your mask, social distance, and make sure you get your flu shot. It reduces deaths, hospitalizations, and you could help save other people's lives too. And absolutely get one now. We've been saying it since August, but there's always confusion over when you should get the flu shot. So absolutely, right now, there's no time like the present. And with that, I'll hand it back to Tonya to go over kind of a more global glance at COVID-19.
Thank you, Dr. Parikh. Really appreciate that very thorough overview of the latest on vaccines. It is a hopeful and exciting time. So what about the rest of the world? How is the rest of the world handling the pandemic? Let's talk for a few moments about that global perspective. Again, we know that COVID-19 first kind of came onto the scene in early January of 2020, but the truth is coronavirus has been around since 1965. That's when it was first identified in humans, and SARS emerged in southern China back in 2002, but then it spread to other countries. But in late 2019, we saw this particular strain of the virus in Wuhan, China. And again, this is a timeline that fast forwards basically from January through April, and definitely shows that SARS-CoV-2 originated, the belief is that it originated in bats and made the jump to humans in some of the Wuhan open air wet markets. And that we had those first confirmed cases in the US from those that had traveled to China in mid-January. And then we see the time that the WHO actually declared this a global health emergency at the end of January before that global case rate reached 1 million in April. And then as we've moved forward, April to now November, as we said earlier, over 50 million cases worldwide. Now, when this first came onto the scenes, there was a study in Lancet in January of 2020 that showed what are those common symptoms. And again, we knew from the very outset that about 98% of patients actually presented with fever, 76 or 3/4 of patients presented with a cough. Fatigue was present in about 44% of the patients in this first cohort, and that there were some less common symptoms like sputum production, headache, as well as diarrhea. And so it was very interesting in this first group of patients from China, we did see some of those common factors that have helped us to better characterize the disease and to better identify people when they began to have these symptoms. Some of the complications in that first cohort included acute respiratory distress syndrome that occurred in about 29%, as well as other less frequent complications. In that first cohort, it looked as if that about 30% of patients were actually admitted to the ICU, and unfortunately 15% of patients in that first cohort died due to COVID-19. As we have gone on throughout time, we certainly have become more aware of the risk of those that are living with comorbidities. And some of the most common comorbidity rates that we've seen with the COVID-19 cases, of course, hypertension is the #1 comorbidity and risk factor with over 30%. In seeing complications there, as well as diabetes at 14%, cardiovascular, supravascular disease, and other chronic liver, lung, kidney diseases as well. So again, I think that we originally had concern that those living with chronic lung disease may be even at higher risk than what has fleshed out in the data over time. So what about how we've come to understand the staging of COVID-19? Again, this is a study that came out this year in mid-year in May that really does nicely characterize each of the 3 stages. And this, again, comes from that global peer-reviewed publication stage in which we have learned. And I think that what has been interesting here is that as we looked specifically at the Chinese Center for Disease Control and Prevention, they had summarized over 70,000 cases to get to this point of sharing this publication. And over 80% of their cases were in this stage 1 or stage 2 phase, where over 80% were mild in nature, and the overall fatality rate was actually fairly low at about 2 to 2.3%. And there was a smaller subgroup that actually had respiratory failure, septic shock, and multi-organ dysfunction in this particular study. But the interesting thing is that in that early infection time, that time of inoculation to the early establishment of disease, that oftentimes symptoms were very mild and very nonspecific. So feeling fatigued and tired, having a fever, having a dry cough, those were those early stage 1 type of presentations of symptoms. And when we look at what the treatment that was recommended at that time, it was primarily targeted at symptomatic relief. And so, the typical rest, fluids, and taking over-the-counter types of treatments. We did find that in some patients, there was a viable antiviral therapy, remdesivir, and of course that's gone on to be approved in some of those targeted selected patients that may be moving towards that latter stage 2 or stage 3. In the stage 2, that's the moderate group of pulmonary involvement with or without hypoxia. And again, you can see here that this is that shortness of breath, and where again they may need to take additional measures of hydrochloroquine and other potential treatments. But then it was that small subset of patients that actually moved to stage 3, the severe systemic hyperinflation, a minority of COVID patients that actually transitioned into that 3rd stage, and the most severe stage of illness. But this was a very instrumental publication that really did help us to understand the way in which COVID-19 could rapidly progress in that minority of the population, and what some of the potential clinical symptoms, signs, and potential therapies that should be considered. So as we look at the latest data from the World Health Organization, in just the last week, we've had over 2.2 million new cases and over 39,000 deaths related to COVID-19 that have been reported across the 6 WHO, World Health Organization regions. This is the highest reported number of cases in a single week thus far. So not just here in the US is this the peak week, it is definitely the same across the world. Interestingly enough, in the over 50 million cases and over 1 million deaths that have been reported globally, about half of them, both cases and deaths, continue to be reported in the region of the Americas, with of course the US, Brazil, and Argentina accounting for the greatest number of new cases and deaths in the region. You can see here that these do show some of those trend lines of country by country over the course of March through November, with the US, again, unfortunately, clearly in the lead, not an area that we want to be leading the rest of the world, but in the sheer number of cases over time. And then you can see other countries as well, like Poland, Brazil, France, the UK, Germany, India, and Spain. And as we go throughout our time looking at this global perspective, we will actually take a look at what some of the different regulatory approaches have been and legislative approaches have been to limiting activity and social distancing. But again, by the WHO region, the European region really has had the greatest increase in cases over the last week. And also, unfortunately, we've seen a significant rise in deaths in the African region, with South Africa actually continuing to register more than half of the mortality rates specifically to the African region. For the 3rd week in a row, though, we have seen some declines. In the Southeast Asia region, there was a reported decline in both new cases and deaths, 6% and 8% respectively over the last week. And it's believed to be that that decline is mainly due to decreases in reported cases, specifically in 2 countries, India and Bangladesh. Also, for the 2nd week in a row, we have seen in the regions of the Mediterranean, Eastern Mediterranean, and the Western Pacific increases in the number of cases and deaths. So you can see here, country by country, the mortality rates and based on the population. And again, I think that the interesting thing is we track this and look at the way in which different countries are responding to the various aspects of managing the pandemic. So these are some of the drill downs of different regions around the world. England has certainly been under the toughest coronavirus restrictions yet, as hospitalizations definitely continue to rise there. The UK Prime Minister Boris Johnson had actually announced that they would have a new month-long lockdown for England as the cases surge. And the CDC does have a travel warning level 3, which recommends travelers reconsider travel to the UK at this time. And you can see the confirmed cases as well as the death toll in the UK. Here's the trend line of March through November for the UK. And again, as of yesterday, 23,000 new cases with 596 deaths, and again, another peak week in the UK for COVID cases. What about when it comes to other areas around the world, like Russia? The Russia daily tallies of COVID-19 are also at record highs, and we are seeing even more restrictive CDC travel warnings at a level 4 for Russia. Moscow residents may actually get the Russian vaccine in the next 30 days. So it looks like that they are creating this large network of vaccination rooms, and that some doctors and teachers are already receiving the vaccine. And researchers around the world have been concerned because there's been a little bit of a lack of transparency and opaque development of this, as well as a lack of real, what we would call mass testing, phase 3 clinical trials here in the US. So while we have seen over 1.8 million confirmed cases in Russia and the death toll rising over 31,000, there is some concerns around that Russian vaccine. Here again, you can see the current trend line with them once again peaking in this November timeframe, with new cases just yesterday reporting over 19,000 and over 400 deaths. When we look at Indonesia, they actually have been recording the most cases and deaths in Southeast Asia, as I said before, and Indonesia's health ministry has actually collaborated with the COVID-19 task force to launch a program to bolster contact tracing in that country. They've prioritized 51 districts and cities across the 10 provinces and are really trying to upscale their prevention and mitigation efforts. There is a level 4 do not travel warning for Indonesia. And again, we can see the confirmed cases and death toll. What about in areas like Colombia? Well, Colombia's lower house abruptly ended its session last week and actually told lawmakers that it was time to quarantine after a member had tested positive. So the CDC has instituted a level 3 warning for Colombia and recommending that travelers avoid all non-essential international travel there. The confirmed cases over 1 million and the deaths again over 33,000. Here you can see the trend from yesterday with almost 10,000 new cases and 184 mortality rate. So, as we look at this and we see what is happening and what are the different factors that are impacting the global perspective, one key area is how we understand air pollution and its relationship to COVID-19. Exposure to air pollution is believed to increase the impact of all respiratory disease, and COVID-19 is certainly included in that category. So this is something that we need to really spend attention and time to, because bad air quality breathes into those small particles that affect lung health, can certainly make air pollution a contributing factor to making people with underlying conditions more vulnerable to COVID, and it could result in more serious disease. So the keys here are practicing prevention, and in countries where air pollution is high, making sure that you're wearing a mask. Again, you're following all of the 3 W's, but definitely taking those additional actions to reduce emissions in the areas where air pollution may be highest. Now, how is this impacting global economies? Definitely the global markets have been sliding downward, and there has been a lot of concern about what the overall social unrest and political uncertainty will mean for the global economy. It's now estimated that the pandemic will likely result in at least a 2 to 3% global GDP loss. And what that means here in the US is about a $77 billion monetary GDP loss in the best case scenario. And when you look at things on the global scale and begin to think a 2 to 3% loss globally, well, for certain industries, like for example, the global tourism industry, that is extremely detrimental, and we've already seen about a $400 billion decline in that global tourism market over the course of 2020. So certainly we've got hope with the hope of the vaccines coming. And again, we know that the new year is just around the corner, and I don't think there's probably anyone on the line that isn't looking forward to turning the calendar and getting prepared for 2021. So now let's turn our focus to social guidance and the differences of US versus globally when it comes to social distancing. Remember, social distancing is that practice of keeping space between you and others to reduce the chance of contact with those that are knowingly or unknowingly carrying the illness. And to help stop the spread of coronavirus, health officials have certainly recommended avoiding large gatherings, as Dr. Parikh said, any gatherings larger than 10 in your home, and depending on your local government, it may be 50 or 100 in other public places, but also maintaining that safe distance of at least 6 feet from other people. The CDC has developed some nice resources, and you can always visit cdc.gov to see those. But again, it's that greater than 6 feet apart that really does help to stop the spread of germs like COVID-19. This is a funny photo that we found that I think, yes, anything can be taken to an extreme. This is kind of an improv everywhere, a comedic performance that took place in New York about the most socially distanced office. And, sometimes we feel like we do have to interject a little bit of humor into these presentations, because these are challenging times, and there have been dark days, and so it's sometimes fun to look for ways to poke fun at this current situation and make light of some of the more lighthearted moments like this one. So when it comes to social distancing, the Harvard School of Public Health has definitely reinforced that intermittent distancing may be required well into 2022 unless critical care capacity is increased and the vaccine becomes available. So, in the event of the apparent elimination of SARS-CoV-2, surveillance really should be maintained, and it could be possible that we could even see a resurgence up until late 2024. So this whole notion of social distancing, and it really is a change in the way we have to approach life. So that prolonged distancing, we know, unfortunately, could have really profound negative economic, social, and educational consequences to society. The CDC's director, Dr. Robert Redfield, has been such a voice in this time, and he actually came out and said that though coronaviruses in the US have been soaring, social distancing does seem to be working, and it seems to be effective. And it is one of the most powerful weapons that we have against COVID-19. And then, as we've said before about Dr. Fauci and the holidays and his recommendation that definitely we should rethink our typical gatherings and really think about this from a local perspective of, the risk of exposure and the risk of certainly sharing the virus. And he said we really got to double down on fundamental public health measures that we talk about every day, because they truly can make a difference. And it may be the difference in our death tolls, doubling or tripling in the months to come. So now we're going to go to a poll. What do you expect, or when do you expect social distancing restrictions to ease up? So we'll launch that poll. Give you a minute to respond. Do you think it's going to be the end of 2020, the first quarter of 2021, the third quarter of 2021, or I'm not sure these restrictions will ever ease? So we'll give you a moment to log in your response if you think that this is coming soon, a little bit down the path of the next year, or perhaps never. Looks like we've got about half. We'll give it just another couple of seconds and then share the results. I'm going to close the poll and share. So it looks like that we've got about 3/4 of the group that says third quarter of 2021, 15% that say this doesn't look like it's ever going to change, and then 10% saying first quarter of 2021. I think it's interesting. I think we all have come to the resolution that 2020 is not going to be the year that we see these restrictions begin to ease up in any way, shape, or form. So I would tend to agree. I think we're going to be looking at the third or fourth quarter of 2021 before we see any substantial changes. So in search of a return to normalcy, McKinsey just put out a report about kind of the two important definitions to the end of the pandemic. And they talked about that the epidemiological endpoint is herd immunity and when that's achieved, but that we need to be focused more on this transition to a form of normalcy where almost all aspects of our life, whether that be social or economic, can kind of resume without this fear of ongoing death and mortality, and certainly that long-term health consequences related to COVID-19. And they talked about, rather than thinking about a new normal, thinking about the next normal, how that might be different in some of the surprising ways, and certainly realizing that getting there is not going to be a sudden thing. It's going to be gradual, and that transition will allow businesses and services to resume over time, whether that be air travel or shopping or factories or even going out to dinner with friends and family. But it will be quite some time before we see these things operating at full capacity. And we've seen this even globally as we look at some of the policies globally on social distancing and some of the restrictions. I mean, regions of Spain and Italy have just recently returned to lockdown. Ireland is going to institute that as well now. And, you know, those lockdowns are lasting from 2 weeks to a month. And in certain regions of the world, there are stay-at-home orders or nighttime curfews. There are mask wearing mandates and laws being passed. And so, again, I think if you look across the globe, everyone is doing the best they can to try to find what that best step is towards the next normal. The truth is, the timeline is going to vary depending on where you are. It's not going to be reached in a traditional linear fashion that we would all like for it to, but it will most likely, we'll find that epidemiological end around the third or fourth quarter of 2021 if people adopt the vaccine and take the necessary steps to be vaccinated. A return to some sense of normalcy, possibly that first or second quarter of 2021 would, depending on where you are in the world, may begin to see some returns to normal. But then beyond that, I think that most people are feeling that impatience to just resume normal life. And the truth is, it's the longer it takes to remove some of these constraints on our economy, the greater the economic damage will be, but also the greater the social damage will be and the educational damage that is often really not stressed to what is being done to our children not attending school or traditionally in the school setting. And so I think there's a lot of things for us to consider as we think about the way in which COVID-19 is impacting both here and abroad. So now at this time, we are going to take your questions. So don't forget to go into the question box and list those questions out. We've got just a few moments to take a few questions. I'll go up and grab a few of them to share here. So one question here comes from Linda Parikh, and it says, how did the number of COVID deaths compare with the number of Spanish flu or influenza deaths from 1918, but then also relative to flu deaths today?
That's a great question. So, you know, our numbers are on pace currently to actually surpass the Spanish flu deaths. The exact number I don't know offhand, but you know, I just pulled it up. So that pandemic had 50 million deaths, but you know, it's estimated that the number was estimated by at least 50 million worldwide. and about 675,000 of those were in the US itself. So if we're projecting to have 200,000, 300,000 cases per day, we're on a pace as the winter approaches that we could easily surpass this number. Because we don't have that vaccine fully approved yet. We haven't been able to achieve that herd immunity yet. So it was 50 million. I hope we don't, come close to that number globally or surpass it. But this is even more reason that we need to learn from the past, and it's even less of a reason for us to do so because we have much more medical advances than they did then, so it's actually sad if the death rate is comparable to then because we should be doing a lot better.
Yes, great. Yeah, I totally agree. And so this next question is interesting. It says, as the vaccines will be released under the Emergency Use Act, does this actually mean that the vaccine will not have met the usual testing for an FDA approved treatment?
Right. So that's also a great question. So, as I had said earlier on, that typically vaccines can take years to develop. The fastest, I think, which was the mumps, was about 4 years. So, it is going to be done at a much faster speed. But that being said, the requirements in place to get something approved, even for emergency use, is that each company has to show at least 2 months of data, especially safety data, obviously, and they have to show that the vaccine is minimum 50% effective or more. Now, Pfizer is saying theirs is 90% effective. But even after all of that, they also have to prove that it doesn't only work, in healthy young people. They have to prove that it works, especially in those high-risk groups, and that it's also safe in those high-risk groups. And since we can't tell the future, these patients are going to have to be followed. So they can't just approve it and then it'd be lost to follow-up because as we know, things can develop that we don't anticipate as well, like a year down the line, 2 years down the line. So it is at a faster speed, but given this pandemic, it's kind of the best solution that we have because right now we don't really have much other defense besides, masking and social distancing.
So that really does lead to Greg's question, which says, where and when do you think that we'll actually be able to see safety data on the vaccinations?
Right. So we have initial safety data. So from what we know so far, at least I can speak to Pfizer and Moderna because those two are the closest to being approved. So far, all of the side effects have been very limited. They resolve within 24 to 48 hours. There haven't been any severe side effects. So overall, it looks pretty safe. And it's common things like pain at the injection site, fevers, malaise, maybe muscle aches, things that are expected from vaccines. And most people feel back to normal within, 48 hours or so. But again, time is the best indicator of anything. So we might learn more things about this vaccine 6 months down the road or 1 year down the road. But overall, the safety data is reassuring. And based on that, I personally, I can't speak for everybody, would take it myself. And I think I had shared in a previous webinar, I've even had my parents enroll in one of the studies, in the Moderna study, because they're both high risk because of their age. My father more so because he has diabetes. So, and I wouldn't encourage my own family members, obviously, unless I felt that it was pretty safe.
Okay. So you spoke about the extreme temperature specifically on the Pfizer vaccination that is in development. There's a question here, is it actually frozen?
Mm-hmm.
Yes.
Oh, that's a great question. So yes, because of the temperature, it's negative 80 degrees Celsius. So it is very cold and close to frozen, but that being said, obviously it's not injected frozen. It's injected once it's in a liquid formulation. So generally once it comes out, there's a period of time that you can have it out at room temperature before you have to inject it into a patient.
So the next question comes around just the presentation of symptoms, and I shared some of the data out of Wuhan where it said that most patients presented with a fever, and there's a question about, is that what we're still seeing now? Are you seeing patients that are presenting with COVID and yet have an absence of fever?
Fever is still very common, but again, you don't have to have it. So Again, we see a lot of asymptomatic spread, which of course is very concerning, especially amongst young populations, in dormitories, in the Army and the Navy just came out with some studies showing that they had significant asymptomatic spread, even with quarantining measures. So unfortunately, you don't have to have the fever, but out of the symptoms, the fever is still one of the most common. Other common things are, loss of smell, taste, shortness of breath, cough, and then of course those stomach symptoms as well, such as nausea, vomiting, diarrhea.
So this is a really interesting question. I know we're a couple minutes over, but we're going to just wrap up with this last question. Some people feel that the mRNA actually changes your DNA. Is that true?
Mm-hmm. No, and I'm glad that question was asked as well, because I do get it from time to time. So it doesn't change your DNA. It actually has no effect on your DNA at all. What it is basically it's instructions. Think of it as like a set of instructions that are delivered to your cell, and those instructions act as what we call the spike protein from the coronavirus. So your cell thinks that it's been infected without all of the bad things that come with an infection, such as fever or breathing issues or even, God forbid, death. And then your immune system then takes that signal to create immunity against it, but there's no impact on your DNA, because the DNA, that you have, that you're born with, it can't change based on that messenger RNA that's coming with that instruction. Basically, it mimics an infection, but it doesn't do anything to your DNA. Just as if I caught COVID today, it wouldn't change my DNA either.
Right. All right. Thank you for that clarification, Dr. Parikh. Very helpful. And thank you all for listening today. I know we didn't get to all of your questions. We certainly will continue to assemble them and relate them back to our FAQ document at allergyasthmanetwork.org. So please always check back there. It's a great resource to see how your questions were resolved or answered in the follow-up to these webinars. I truly want to thank each of you for listening with us today as we've looked at COVID-19 in your neighborhood and around the world. I also want to invite you to join us for our next COVID-19 webinar, COVID-19 and COPD, Coordinating Care. This webinar will be on December 3rd at 4 p.m. Eastern Time, and you can register at our webinar page under News on the allergyasthmanetwork.org website. Thank you again for joining us today. My name is Tonya Winders, and on behalf of the staff at Allergy and Asthma Network, we want to continue to work with you each and every day to meet your needs during this global pandemic so we can all breathe better together. Thank you and have a wonderful day.